Now that we have heard all of the causes of tinnitus, let's get into the section about the treatment. What can be done about tinnitus? So as far as the tinnitus that is caused by inflammation and infection, it can be normally cured up with a variety of doctor prescribed antibiotics, which would be for a bacterial infection of the outer or middle or inner ear, or it can be cured up with antifungal medicine, which could be in pill form, or drops, which will be taken into the ear. It can also be cured up with corticosteroids, which are pretty much used if it's an allergic reaction that is causing the inflammation, which in turn causes the tinnitus in the ear. And through the last part of this, as far as obtaining these medications for yourself and getting the proper care and treatment that you need, I recommend that you visit a ear, nose, and throat specialist and also an orienterologist. If you have an inner ear infection, then an orienterologist deals with the inner ear. They will be able to help you there. As for the ear, nose, and throat doctor, they deal with the outer ear, which could be infected, or the middle ear, which could be infected or having fluid or eustachian problems. That if you do these things, if you have an infection, more than likely after you take your course of medicine, your tinnitus will stop. And those are the first doctors I recommend that you see in your quest for a discernment as to the diagnosis of your tinnitus. As for the cure for the loud noises or sounds induced tinnitus, I will cover that in another video, because this also would be the cure to deafness, which is something that has eluded even doctors and scientists in the imaginations for centuries. I will cover that in another section for the treatment for that. As far as the current treatments go, though, however, for the noise-induced tinnitus, say if you hear a loud bam and suddenly you have ringing in your ears and you have some sort of hearing loss, there is current treatment, but there's a limited window of opportunity to do this treatment. And that limited window of opportunity is about 3 months. So those of you who have tinnitus, who believe that your tinnitus was caused by loud noises or hearing loss, I recommend that you get something done that's called hyperbolic oxygen therapy. Now, what hyperbolic oxygen therapy is they will put you in a pressurized chamber similar to what dive masters do before you dive deep within the ocean's floor, and they will pump this dive chamber that has been pressurized with pure oxygen. And what this oxygen does is it supersaturates your blood with super rich oxygen and in your arteries, and this actually, because of the pressures, the oxygen enriched blood manages, and some of the oxygen manages to get into the cochlea of your inner ear, and it combines with those inner ear hair cells that like I said earlier, before they get smashed over like a tree if you're driving over them at 70 miles per hour with your car. What the oxygen does to those inner ear hair cells, it gives them an extra boost so that they may repair themselves and stand up straight again and heal themselves, so that they'll be able to absorb sound correctly. But the typical window on that treatment is only 3 months. You do not have that much time. And once those cells have fallen over and they've died, they'll either disappear, they'll either be gobbled up by the body, they'll disappear, or they will never grow back ever again. And that is the problem that causes permanent hearing loss. It cannot be repaired. Once it's gone, it's gone. But that might not be true with the theory that I have. The next, this is something that's in development right now that, like I said, along with that treatment with the hyperbolic oxygen treatment, there's another thing out there it's called a Skinar machine, which it does produce a similar effect as far as noise-induced tinnitus goes, as like hyperbolic oxygen therapy. It might, but this is just in very baby stages, and there's a guy out in Britain who's actually working on this right now, this invention, who is trying to see what the benefits of it are. It still has yet to go through the clinical trials and things, but he's out there on YouTube. You can find him as well. I wouldn't recommend that. I'd recommend hyperbolic oxygen therapy, and I will recommend this theory that I have in another video as to how to cure deafness and how to cure these simple problems. Now, the next major treatment and cause, musculoskeletal problems. Now, this one, I honestly believe that my tinnitus is caused by that. And I can show you all just maybe a simple example. As far as this goes, sometimes what musculoskeletal tinnitus can be caused from, it can be caused by subluxations, which are misalignment of the cervical vertebrae, which it leads to a muscle imbalance, which causes the muscles that are responsible for opening the jaw, the hyoid muscles, to sort of, I guess you would say, not work in conjunction with one another. Now, as far as the musculoskeletal problem goes, it's kind of like a domino effect, as you would say. You have a problem in your neck, and then it causes, because of the muscle imbalances and problems, it causes a problem in your jaw. And a lot of people who experience temporomandibular joint disorder, which is TMJ, may also experience tinnitus or ringing in the ears. And that has to do with the fact that atomically the muscles, which are the pterygoids, which sit on the internal part of your jaw up in here, they become overstrengthened because these muscles here, the infrahyoid muscles, don't work in conjunction with your jaw muscles in opening the jaw properly. And what happens is these become too large, which they in turn overgrow their home on the plate of your skull there. There's a I'm trying to remember the name of it. So many crazy names. I'll explain that in detail in another section. But it can, because it grows so large, the pterygoid muscles, they in turn pinch off nerves and muscles that are located to a small muscle that goes up through the eustachian tube into a nerve ending and tendon, which goes into the middle ear, which is like, as I would like to call it, it's called the tensor tympani muscle. And that one, it can cause tinnitus and partial deafness and all the stuff that I've experienced. And I honestly believe it's the cause of mine. Now I'll get into the treatment for that here, so we can keep that short. I'll go into the specifics on that, so you guys might be able to be helped if you're in a similar situation, and point you to the right doctors. As far as that, chiropractic care to realign the spine is a key. Physical therapy to fix the muscles here. Recommend seeing a temporomandibular joint specialist who specializes in musculoskeletal problems of the jaw and neck region. Massage therapy. Just wearing a mouth guard to essentially retrain the muscles and make them do what they are supposed to do. And that should clear up the pinching off the tensor tympani nerve endings that cause the muscle to spasm and pull on the, I think it's the malleus, the bone in the middle ear that tenses up the eardrum, and because it's tensed, it pushes on the stapes and all that other stuff, and it's like as if somebody pressed a key on a keyboard and never let go. If you have a muscle problem like that, it'll continue until you correct it. And that is what the treatment is for that. I'll get into the specifics of all of these, but as for the brain tumor, the acoustic neuroma, get to see a doctor right away, because this could kill you. They say it takes a few years for it to really be noticeable on an MRI, but I would definitely get it checked out. Normally the treatment for that is outpatient surgery. They'll cut open your ear and do work inside your brain, and yes, and you might be able to lose your hearing because of it, but you have to make a choice whether or not it's you want to hear or do you want to be dead. You know, that's your choice. So I recommend getting an MRI to determine whether or not that is true, and seeing an orienterologist, a specialist in the field, and they will be able to perform the surgery and all sorts of things. And as for the excessive earwax, that can be easily cured with a ear, nose, and throat specialist, and they can take their special water instruments and the, I guess you would say, special machines that they have in removing the wax out of your ear and allowing you to hear and getting rid of the tinnitus. It can cause a sort of buzzed hearing, kind of funny hearing sound when the earwax is up against the eardrum. So, and meds, simple suggestion: if you're taking antidepressants, all sorts of stuff, they can produce tinnitus. I mean, there's a gobble list of all the stuff. Pretty much what they found is you pretty much have to stop taking them altogether. Drink water. That should put those problems at bay, and that should help. Just stop taking them. That should get rid of the tinnitus. You might want to check and see if it's your medication first that is causing it.